Hormones play a crucial and often underappreciated role in shaping the quality and patterns of our sleep, especially for women whose hormonal landscape shifts dynamically throughout their lives. These biochemical messengers influence nearly every aspect of sleep, from the timing of when we feel tired, to the depth and restorative quality of rest, to how well we stay asleep through the night. Understanding how key hormones like estrogen, progesterone, and melatonin interact provides profound insight into why women often experience unique sleep challenges during various life stages and how these natural fluctuations can be supported for better rest. Melatonin is perhaps the most well-known hormone related to sleep. Often called the sleep hormone, melatonin is produced by the pineal gland in response to darkness, signaling to the body that it's time to prepare for rest. Its release follows a circadian rhythm, peaking at night and dipping during daylight hours. Melatonin regulates the sleep-wake cycle by helping to lower core body temperature and induce feelings of drowsiness, effectively setting the internal clock that aligns sleep with night. Women generally produce melatonin in similar amounts to men, but its production can be influenced by other hormonal changes, particularly those involving estrogen and progesterone. Estrogen and progesterone are two primary female sex hormones that fluctuate throughout the menstrual cycle, pregnancy, postpartum period, and menopause, each exerting distinct effects on sleep. During the follicular phase of the menstrual cycle, estrogen levels rise, which tends to have a positive influence on sleep quality. Estrogen enhances REM sleep, the phase associated with dreaming, emotional processing, and memory consolidation, and supports deeper, more restorative sleep. It also helps regulate neurotransmitters like serotonin, which promotes relaxation and mood stability, making it easier to fall asleep and stay asleep. As the cycle progresses into the luteal phase, progesterone levels increase and then decline if pregnancy doesn't occur. Progesterone has a natural sedative effect, promoting feelings of calm and mild sleepiness, thanks to its interaction with GABA receptors in the brain. These are the same receptors targeted by many anti-anxiety medications. This sedative effect can make the luteal phase a time of easier sleep onset for many women. However, the hormonal fluctuations during this phase can also cause disruptions such as night sweats, increased body temperature, or mild insomnia in others, especially if combined with stress or underlying health issues. Pregnancy introduces a whole new hormonal environment with elevated levels of both estrogen and progesterone, alongside other hormones that influence sleep. Early pregnancy often brings increased sleepiness and longer sleep duration, as the body supports the immense physical and emotional demands of nurturing new life. However, as pregnancy progresses, discomfort, frequent urination, and hormonal shifts can disrupt sleep, causing many women to wake frequently or struggle with insomnia. Postpartum sleep challenges are often compounded by fluctuating hormone levels as estrogen and progesterone rapidly decline, which can contribute to mood disturbances and fragmented sleep during this demanding period. Understanding the hormonal underpinnings of these sleep changes can foster greater compassion for new mothers and encourage supportive sleep strategies. Menopause is perhaps one of the most significant hormonal transitions impacting sleep. As estrogen and progesterone production decline, many women experience increased sleep disturbances, including insomnia, night sweats, and restless leg syndrome. Lower estrogen levels reduce REM and slow-wave sleep, the phases essential for emotional balance and physical restoration, making sleep less refreshing. This decline also affects melatonin production, which can further disrupt circadian rhythms and make it harder to fall asleep at night. Fortunately, awareness of these hormonal influences opens the door to targeted interventions that can improve sleep at every stage of a woman's life. Lifestyle habits such as maintaining a consistent sleep schedule, managing stress through mindfulness or gentle exercise, and creating a calming bedtime environment can support hormonal balance and sleep quality. Nutritional choices rich in magnesium, vitamin B6, and omega-3 fatty acids also play a supportive role in hormone regulation and nervous system health. For some, medical options like hormone replacement therapy or melatonin supplementation may be appropriate, but these should always be discussed with healthcare providers to tailor approaches to individual needs. Additionally, therapies focused on improving sleep hygiene, cognitive behavioral therapy for insomnia, and relaxation techniques can mitigate the impact of hormonal fluctuations on rest. In essence, the dance of estrogen, progesterone, and melatonin weaves a complex and beautiful pattern that profoundly shapes women's sleep throughout life. By recognizing and honoring these natural rhythms, women can better navigate the challenges of hormonal transitions and embrace strategies that nurture restorative sleep, ultimately fostering resilience, well-being, and vitality at every age.